Welcome to this special edition of The Tea, and I am so pleased to have with me the president of the National Medical Association, Dr. Roger Mitchell. Hello, Dr. Mitchell. How are you?
Good morning, April. It's great to see you again.
Um, Let me tell you, we are in the midst of a healthcare crisis. People know that there's a problem, but I'm calling it a crisis. Am I correct, sir?
It is a crisis, and it's the calm before the storm is what it
Ooh.
is. We are preparing for the storm, to continue that metaphor. I mean, we're watching the clouds roll in, and people are acting like it's not going to hit us. This hurricane called the loss of Medicaid, the hurricane called the loss of access to care in both urban and rural America. So this is the calm before the storm. And there's several that are feeling the storm today because of their access to care.
So, and we've got so much to talk about in this few minutes that we have. We're going to cram it in, and we're going to do it in layman's terms, guys. You understand pain. You understand the money when your insurance rates are here and they rise to this level, and that's where we are. People are going to have to determine, can I pay for insurance if there is not a solution to this crisis, this healthcare crisis, ACA, between Democrats and Republicans, well, basically with Republicans by December 31st. So let's start with that. December 31st is the deadline. We're just days away, sir. People who have health care, their health care will go from maybe $800 a month or less to thousands of dollars a month. Are you hearing that people are trying to push forward to pay for it, or they're going to roll the dice?
Well, there's many that are going to make choices, particularly young folk that may be entrepreneurs that have enjoyed the fact that they had been qualified through the ACA to get health insurance at a lower rate. They're paying in to health insurance, but not really pulling out of health insurance because they're relatively healthy. Those individuals will truly make the decision that they prefer not to pay for it because they know that they don't need to go to the doctor as much. It's
Um, yeah, they're
yeah,
healthy.
they're like, I'm
Yeah.
good. I'm good. I don't have any aches and pains. I'm 30, 40 years old.
Whew.
I'm self-employed, but I have the ACA to cover me as an individual. It's and therefore the premiums go up because those individuals come out. And then the premiums are going to go up in general because of the lack of an extension of the ACA. And it's those that have families, right? I have a family. I have a daughter and two sons, and they're less than 26 years old. My premiums are going to go up. I'm an independent physician, right? So I don't have health insurance that comes out of an organization. My premiums are going to go up, right? But I have to do that because I have a daughter who has a chronic illness that I have to make sure that she gets the care that she needs. So then my family's going to have to go without in other places, but there's individuals that will make the decision not to buy health insurance.
And a piece that you didn't mention, and you did, but you alluded to it. ACA allowed us, the Affordable Care Act, better known as Obamacare, allowed us to put our children on our insurance until 26. I have a 23-year-old that has a chronic illness as well. And I'm like, wow. And this is the first time I've not had insurance myself. I'm on my husband's insurance. And this is how vulnerable people are. I mean, I'm on my husband's insurance and he insures all of us. Imagine, like you, imagine people who have to go out and find their insurance. It's crazy. And it's life or death. Let's put it there. Because
It is life or death.
anything can happen at any moment. And it's so interesting how the people who are making these decisions are people who don't go to the grocery store. And not only do they not go to the grocery store, they don't use coupons. These are people who can buy a hospital, by themselves. Whereas we are looking through the coupons to find at the local pharmacy, what can I get at half price to deal with this toothache? What can I, or with this headache? That could be something else and we don't know. So this
Well,
is
April, people are going to make decisions not to get preventative care, not to get annual physicals, not to get their annual prevention, not to get their
mammogram.
test for their PSA, their
Yeah.
mammogram. They're going to make decisions not to do that. And then it becomes going to the emergency department in order to receive care. It's the old trope, right? We've been saying this for the last year. Well, it feels like a year, right? Since
What
January,
is January
February,
20th? January 20th,
right?
25. That's when Donald Trump.
Right. So we've been dealing with this for a long time, and it's really this whole HR1 is a lazy way of dealing with healthcare reform. There's no doubt we got to reform our healthcare and our healthcare spending, right? But to do it on a spending bill versus a healthcare bill, this is a spending bill that got passed. It's not a healthcare bill, and then we're trying to reform healthcare within a spending bill, and that the right people weren't at the table to have conversations about how to provide the proper healthcare for Americans in this time.
So, so Dr. Mitchell, as Republicans are working this out, Dems are basically just waiting to see so they can counteract or, try to counteract. But at the end of the day, this is all Republicans because they're in the majority. Um, Republicans have a compromise that you want to talk about. What is it?
Yeah, so HR1, and we have been against much of what's in HR1, but in HR1 there is a $50 billion that is going towards rural healthcare. Applications have already gone in from states. How this works is about 25 billion that is for every state, and they get to use it, and then there's another 25 billion that is going to be at the discretion of CMS on what states get that rest of those money and how they're going to spend it. This is important because when we hear rural, we often have a reverse dog whistle response that's white folk. But what we know at the National Medical Association is that there are pure black rural counties in this country, in Arkansas, in Mississippi, in Alabama, in Georgia, in Louisiana. I mean, that southwest and southeast component of this
Or
country, there is rural black folk that need access to care. And so this is extremely important for the National Medical Association, Black Docs, and for community to be at the table watching and advocating to make sure that that $50 billion over the next 5 years is being spent in the care of our communities as well. Because much of those individuals, they go from rural, but they get their care in the urban centers. So
mm,
there's so much that we can do there, particularly surrounding transportation and the like, to make sure that people get care.
you're absolutely positively right. Most blacks are in the South. However, when you're talking about $50 billion for rural care, what happens to the suburbs and urban America? I'm waiting to hear about that plan.
Yeah, and it's clear that there is a need to isolate those of us that are suffering all over the country. And that's where the lie begins, because if individuals need care that don't have care in one part of the country, then they need care that don't have care in every part of the country. But as we advocate against that, I'm of the position that we can't be on the sideline and allowing for those dollars that are going towards rural healthcare to not also affect our community. We need to make sure that we're not left out of that while we're advocating for more.
I want to rewind a bit. You said something so poignant. This is not a health care bill. This is not a health bill. This is a spending bill. And we've had this conversation so many times. The right people aren't at the table. The physicians aren't at the table. Yeah, there may be some physicians who are in Congress, but the people who deal with rural and urban America and suburban American health were not at the table with this. That is a big point. And I can't help but think what Sanford Bishop, Congressman of Georgia, said. Because America slapped Republicans in the face about this, Republicans are now trying to make this affordable. The question is, they've had how many years since ACA has been into effect, and now all of a sudden they're worried about it?
Well, it's organizations like ours, National Medical Association, that wasn't at the table. And in fact, where places where we were at the table, like the ACIP, that made recommendations surrounding vaccines, surrounding hepatitis B and other vaccines, we were at the table, and they removed us from the table. So there is a whole movement of moving scientists and physicians that have been doing this forever, away from the decision-making process for political propaganda.
So the reason why you were moved away from the table, let's talk about that. Another DEI anti-woke. National Medical Association is the National Medical Association is made up of what group?
3,000 Black physicians, over 3,000 active Black, and we represent 50,000 Black physicians all over the country. And those are the individuals that are taking care of communities of color, the disenfranchised, the disinherited, and quite frankly, are have been the experts in this immunization space, the immunology space, the pediatric space. We have all 26 specialties within our organization, and so we're our members are leaders in all associations and in all spaces of science and medicine.
And let's drill down on this. Black physicians are breaking history. And one most recent that you may know, Kizzmekia Corbett, can you say her name?
Mm.
Moderna scientist. We are out there. Moderna was for everyone. And then they're pulling the National Medical Association from the table. Also, and I'm going to tell you, Dr. Mitchell, all I do, my mother, when I was a child, she kept singing the name of Dr. Charles Drew. That's all
Mm.
I could. Dr. Charles Drew, Black man who modernized the blood donation system. And because of racism, he died on the road in the South because he couldn't stay at a hotel. He fell asleep at the wheel. And when he got to the hospital, I talked to his daughter, Charlene Drew Jarvis, who was a city council person in DC. She said that they would get ready to take him downstairs to the Black portion of the hospital, and a white physician realized who he was, took him upstairs, but his wounds were so grave that he didn't survive. Racism killed this magnificent scientist and doctor. So guys, and now listen to this. That was back then, and they're pulling Black doctors and scientists from the table in
Yeah.
2025. That's
In, in,
ridiculous.
in fact, in fact, in this last conversation, we're still, although we're not voting members and part of the ACIP, associations are available to listen on Zoom in real time and put up their hands when they have questions or concerns or issues. Our hand, when they were making the decision to withdraw newborn hepatitis B vaccines, our hands were up. We had comments that we wanted to weigh in on the importance of keeping that vaccine in place the way it has been since the early 1990s. And our hands were not acknowledged. And these are the types of things that are happening behind closed doors that your viewers and that our community needs to understand that even though there's an attempt to silence our voices, we're still working hard to make sure that our voices are heard.
I'm incensed, and I keep blowing just to exhale because I don't want to hold it in. I want to release that negative energy, but it's racism. And this vaccine, this Hep B vaccine for babies, that's the common in controversy right now, that everyone's talking about. I was watching some news show, and a doctor that happened to be pregnant said that she was against what uh, Robert Kennedy is doing. And when she has her baby in the next couple of months, she's going to make sure that baby gets a Hep B vaccine.
B.
Can,
Mhm.
yeah, can Americans opt to get it still, even though they're saying they're not going to make it available?
Well, they and see that's where the confusion is, right? The confusion is that yes, you can have conversations with your pediatrician, with your primary care provider, with your OBGYN and make plans to ensure that your baby gets her new his or her newborn vaccine of hepatitis B. It's very safe. It's been safe for years, and so that's always been the case. It's always been the case where you have conversations with your provider and say, "Hey, these are the vaccines. Is there issues? Do you have questions? These are the ones that are mandatory in the sense that we are going to get them without providing with mandate with
It's
our
not standard.
authority."
It's not mandated anymore. You can still
Right.
get it.
Now it's not mandated. You can
Right.
still get it, but that creates confusion. And when you don't have and they're making it mandatory for those women that are Hep B positive. Well, you can have Hep B and be not be positive. You can also have people in your home with hepatitis B, and we know that it's through fluids, but you can have a cut in your gums and your and a blood on the table. It's a very fastidious virus. It is a virus that can last in spaces, and so individuals can be exposed in community to hepatitis B. We've done since the beginning of this vaccine. We've done a good job in bringing hepatitis B cases. I mean, down, particularly in Black communities and those poor communities. When you remove these types of clear healthcare instructions, you create confusion, you create hesitancy, and you put people at risk. And this leads to liver disease earlier than in normal people. And that liver disease, you may have heard of it, cirrhosis, which is fibrosis of the liver.
The hardening of the liver.
That's
Cirrhosis
right.
of the liver is like when you drink alcohol, you can harden your liver.
That's right. That's right. And this virus can do that as well. And it does that, right? And you can have some treatment for it. But why do that when you can have universal precautions in the form of vaccination for all of our babies?
So basically, we what we're talking about is you're going to have to be more communicative with your doctor. You're going to have to
That's
advocate
right.
more for yourself. Um,
That's right.
and what other changes in vaccine mandates are you concerned about? Because this Hep B, thank you for giving us this information. The whole conversation has flabbergasted me that you had your hand up to make a recommendation because you're a Black organization, this anti-DEI, anti-woke time. They walked away from, pulled you away from the conversation, all of that. And now this is life or death again. And if you have cirrhosis, does it? Because you know certain parts of the liver. I mean, they say the liver does it heals itself and it grows back. But when you have cirrhosis, it doesn't, or does it?
It doesn't. And that's the thing is that when it starts to harden like that, that is really the liver taking you into failure, right? And there's treatment for cirrhosis, but with if you get exposed, if you're as early and have this hepatitis B, there is no cure for hepatitis B. There is only treatment. The only cure is not getting it at all. And that's why it was so important for it to be at newborn. And this is what they did. This is what they did. They said, okay, we're going to take it away from newborn, but at 2 months you can get it. Well, and we know that the vaccine is safe. So why create a issue where an issue doesn't exist? It
That
is all to create a perception of them doing the things that are necessary for health when they're actually tearing down decades of work for the CDC. It's funny. CDC directors have come together and they're talking about not relying on information as it pertains to vaccines, not relying on issues that coming out of the CDC, not relying on those recommendations. And that's unprecedented. We have been leaning on the CDC for our information
the Center
forever.
for Disease Control. They have stripped everything out that even talks about equity, inclusion, any data that deals with us. We don't have the baseline anymore as to how things are working, vaccines, research, anything. This is crazy.
Yeah. Yeah. And so that's why you're so important. That's why journalists are so important. That's why coming together in community is so important. And that's why we have to make sure that we're educating our community for our community, with our community. And that's why it's so important for us to continue to try to make sure that we have more Black physicians, more physicians of color, more women physicians, more physicians that are going to go into community and serve community with the truth of our circumstances, not the lies that are being put forward today.
More physicians at a time when there's a physician shortage. How about that? And again, is there any other vaccine that you're concerned about a change in the mandate?
Well, again, I think that what we're going to see is a stripping away and a pushing back on all vaccines. And so we have to be vigilant. We have at the National Medical Association a vaccine task force that really its whole job is they're immunologists, infectious disease doc, and pediatricians on this task force, and their whole job is to monitor what's going on with the ACIP and the CDC, and make recommendations. And actually, as for me as the spokesperson for the National Medical Association, making sure that I have the information to continue to give it to community, to our community, and journalists like you.
Dr. Roger Mitchell, thank you for sipping tea and knocking the pot. You have your tea. I saw you with your mug. Hold your mug up because I don't have.
Yeah, I got. Yeah,
Yeah,
I
I
didn't
am
want to
a
get caught
man.
without
That's
my
right.
mug.
Yes. Thank you for sipping tea. That's right. And knocking the pot over. How about that?
Yeah. Yeah. And
Thank
so for more, if you want more information, you can go on to www.nmanet.org. There's ways you can get involved. We have societies in every state in the country, all 6 regions. You need to connect with an NMA doc near you so that we can get you the care you need.
you. You heard it here on the Tea with April. Have a good one, guys.